I've been depressed multiple times in my life at this point, and it's not fun. And it does take a lot of effort to dig yourself out. And it makes me much more empathetic for the people who aren't able to dig themselves out, that do end up uh, committing self-injurious acts or killing themselves. So this is the most dangerous question I think I'm asking today is, have you ever had a patient lose their life to suicide? Harvard graduate, PhD clinical in psychology, current professor and therapist. Robert, thanks for joining me.
Yeah, of course. Happy to be here.
Yes. So tell me a little bit about, when did you know you wanted to work in clinical psychology and specifically work in suicide and self-injury prevention?
Absolutely. So I guess my interest kind of started when I was in college. I was volunteering as a freshman at Boston Children's Hospital. I was working with kids from disadvantaged backgrounds, and some of the kids I kind of was working with, I realized were self-harming, and I thought, that was, something that really like tugged at my heartstrings, but also kind of posed like an interesting philosophical question from an evolutionary perspective, right? We've evolved to have like these self-preservation kind of impulses, and we want to be able to live and thrive. And I was kind of just intellectually curious about like what would drive someone to do the opposite of that. And so it was at Harvard where I was really lucky to work with Dr. Matthew Knock. He's one of the leading researchers in suicide prevention. And, he taught me kind of like the ropes working in his lab, how to do lit searches and everything. And it was a path that kind of like I continued to follow as a research assistant at Brown for a little while before I went to grad school at George Mason. I've kind of continued that through UCLA, where I was a postdoc for about 2 years, and now as a professor here at Texas State.
Awesome. Awesome. Yeah, that's a really noble but dark calling. I think a lot of people respect what you do, but they would never say, I could do that. Like I know, like my mom, for example, she always wants to, she's very tender-hearted, but I don't think she could handle working hands-on in suicide and self-injury prevention. So thank you for doing that on behalf of the rest of us, so to speak.
No,
And
thank you so much for sharing that. Yeah.
yeah, so you said that you learned some ropes at Harvard, and that's when you started working with therapy. Can you tell me a little bit about the different types of therapy you've specialized in?
Absolutely. So, I have received most of my training in like cognitive behavioral therapy and dialectical behavior therapy, or DBT for short. I've been introduced to some concepts in acceptance and commitment therapy, which is called ACT. And so a lot of my clinical training is in this kind of like CBT space. During internship at UC Davis for a while, I trained in trauma-focused CBT. So it's kind of working with folks who have like significant trauma in their lives, like you know, instances of abuse, things like that.
Nice. And I know that your perspective has definitely changed. I think going through grad school, sorry, and especially getting a doctorate in any given field can radically change your perspective of life in general, and then whatever specific field that you're specializing in. So we all set out naively, we step into our career or our research studies, and then there's disillusionment or maybe even greater appreciation for whatever we're studying. So how did that happen to you while you were getting your PhD, and now that you have a lot of clinical experience under your belt?
Yeah, that's a great question. I feel like in terms of like the research piece, it was something that I didn't quite know how challenging it can be to, like acquire funding, for example, and come up with like, helpful research ideas and all the stats behind, you know, analyzing data. And that was something that I just didn't really have any kind of idea about until I started really digging into it when I was in grad school with like my different mentors, and just it's kind of all the different kinds of approaches you can kind of take to kind of have a published paper out there when you're trying to like, put forth an idea that will hopefully help people. Um, I guess another thing would kind of be the idea that, research it's hard to access for a lot of people, which makes a lot of sense because, there's paywalls often for journals. to be able to read, what people kind of put out there. And so there's a lot of discussion within at least, the research space about how to kind of better disseminate our work to kind of have maybe it have like a greater impact on society at large.
I feel similarly. Obviously, I didn't study a PhD nor clinical psychology, but there is that look behind the curtain once you do research. And I think the outside public has this notion that research is the kind of like what you see in the movies of the white cloaked scientists with their vials and high end equipment. And I don't, especially in the behavioral world, a lot of research is a underslept 28-year-old in, with our studio open for the 12th consecutive hour, bashing their head up against some data. And I don't think people appreciate how technically difficult, boring, monotonous, and also how many different individual skill sets are required for research, even of really basic baseline ideas. It's a lot of bureaucratic work, the paywalls, all of that. So yeah. Any comments on that?
Yeah, no, I appreciate you kind of bring that up because I mean, I wouldn't say it was like my entire grad school experience, but there was definitely some of that in terms of, like really thinking about the research questions and like learning all these different stats skills. And especially in grad school, like, for a PhD in clinical psychology, there's just so much you have to know, not only in terms of research, because it is like a research focused kind of um, degree, but also there's the practical component where you have to like learn all these like therapy skills, how to be validating and how to, provide the appropriate care to someone who is like really hurting in that moment and try to be, understanding of their perspective, whatever it might be, just because, you don't really ever know what someone's going to come through the door with. And they could have wildly different views than you. So that's something you also kind of have to think about and work through as a therapist.
Right. Yeah. So you're in an interesting position. I think all clinicals are in this because you do the research side, you do the locked away on your laptop for hours on inside, but it's also a very human forward focusing practice as well once you get to the practicum side. Whereas me, I went the engineering route. There's very little human facing work. So a lot of my work was very much isolated. So how do you balance that, I suppose, or how do you learn the different skills required for the scientific rigor required for the research versus the empathetic bedside manner type skills required when somebody comes to your practice and they might, honest to God, be self-injuring or having suicidal thoughts?
Yeah, that's a great question. So, I mean, in grad school, at least at Mason, and I feel like it's generally this way across different places, is that they try to find a balance. You're doing clinical work through courses that you're taking, and you have practicums where you're closely supervised by licensed psychologists. Um, but then there's also kind of like a push to be able to, learn the statistics. So like you have like this wide breadth of classes that you have to take. And then you do have to, there are like other hoops you kind of have to jump through when you are in grad school for a clinical PhD. So after my 5th year in grad school, I had to do a 1-year internship, and that was only clinical work. I mean, I was able to do a little bit of research on the side, but it was like 40 plus hours of clinical work a week. So they wanted to really make sure that it was something that you could kind of work on effectively. And that's kind of where I learned things like TFCBT and DBT more, just because I was like doing clinical work full time, which I had never done before.
Nice. So you've mentioned CBT and DBT a lot. I think CBT is probably more popular in the cultural sphere. I hear that one outside of clinical circles. DBT, however, and some of the other therapies, I don't hear about hardly at all. So can you tell me a little bit about what people in the cultural sphere might not understand about therapy?
Yeah. So I guess breaking down just a little bit in terms of like what the acronyms mean. So CBT is cognitive behavioral therapy, was developed by Dr. Aaron Beck. And it's actually one of the most widely studied of the like psychological therapies available. And a lot of the newer therapies are kind of like a lot of newer therapies are derived from CBT. So, for example, DBT, which is dialectical behavior therapy, developed by Dr. Marsha Linehan, and that therapy was specifically originally designed for individuals with borderline personality disorder and who had like self-harm behaviors. Um, that's like a much more intensive kind of therapy where you're like, seeing an individual therapist for an hour a week to learn very specific skills. You also have to go to group therapy once a week. You also are available as a therapist, like, 24/7 to your client, in case they need like skills coaching, in terms of, having a situation happen. Can you help me kind of use the skills I've been learning in therapy? And that way they can kind of generalize the skills they learn in therapy out in the real world and like in their lives. And then you as a therapist also have like part of this consultation team where you are meeting with other DBT clinicians to be able to kind of talk about your cases. Like, if you're stuck somewhere, what are some things that we can do to help you feel unstuck in the situation, which I think is a really helpful model to have, especially with like really high risk cases. In terms of, things that people might not necessarily know so much about in terms of therapy is, CBT and DBT, yes, are helpful in terms of, addressing some of the things that they were designed to address are. And at the same time, like, we still don't quite know what kind of therapy is most effective for what particular condition or like what kind of presentation someone comes with. So, for example, someone comes into the clinic and, they might have like compulsions and obsessions. They might have OCD. So we do have, really effective treatments for that. But, everyone who has OCD is not obviously exactly the same. So there might be particular characteristics that might make someone more, or less kind of like, a fit, or like in terms of fit with like for a particular kind of therapy. And I think that's something that like intervention work is still trying to really address with like the idea of like precision medicine when we're thinking about like even like biological treatments, like for example, SSRIs for depression and things like that. I think that's kind of like one of the big frontiers in intervention research right now.
Wow, that's super interesting because I think people lump therapy together, right? It's become very culturally relevant in the zeitgeist, so to speak, of, oh, go to therapy, go to therapy. And unless if you know the insider trading on it, you can go to therapy and not realize what your therapist is doing, and that they are potentially following an empirically backed, rigorous model, such as, I didn't realize that about the DBT, where it's this entire framework. It's not just sitting and talking about your feelings, which seems to be more of the cultural notion of therapy. But with DBT and especially CBT, because I come from cog sci background of like, no, you're actively trying to rewire parts of your brain using methodologies. So do you have any idea of why there's that split between what the research and what the science actually is regarding therapy, and then the cultural takeaways from it?
Yeah, that's a great question. I mean, I feel like it's a complicated answer. I mean, one of the reasons why I think might be because, like I was mentioning earlier, a lot of research is often paywalled. And unless, if you're like a therapist who, sees clients for a living, you're kind of having usually clients back to back, like every day. It would be really hard to kind of find the time and just like the financial, kind of support to be able to then have to pay for all these like articles, right? Like it's just, it feels kind of less doable. When I've worked in like academic medical settings from most of my career at this point, and, because we are affiliated with like some sort of college or university, we usually have access to like academic journals, and, we're really devoted to research. And so it can be very hard to kind of find that balance. There's something that's often kind of like talked about in terms of like that chasm or gap between research and practice that, I'm not sure how recent it is now, but it's often cited like, we have like about a 10-year gap between the research that's like produced and what's actually like disseminated out into the world. I think luckily there's been a big push recently to, be able to disseminate research much more readily. I mean, there's a whole like division in terms of research around implementation and dissemination, which I think is really interesting. I started really picking up, I think, when I started grad school, but it is just really hard work to be able to just kind of disseminate this research in a way it's also understandable to people. I mean, people just it can be really technical and can be hard to understand. So it means even more time devoted to having, just these new kind of principles or guidelines kind of absorbed into like your everyday practice.
Yeah, you touched on a few things there that I think are really interesting. That the people that aren't engaged in research or doing lit reviews have never even read a journal article before. I've learned that is a very exclusive skill set, might I say, that there's no need for it unless if you're doing research. Until you step through those university doors and you're called to do a lit review, no one's actively going to pick up a journal typically. And then they're not familiar with the paywalls. And I think, at least in my experience, there is this cynicism directed toward the paywalling of the research, especially when it comes from public universities, that this is a public university, so it's funded by taxpayers, and then there is research happening under their roof, and they conduct the research, whatever might happen, and publish it. And I think a lot of people would argue that's that should be public information rather than being hidden behind a paywall. But the journals do need to disseminate the information, and also that is a skill set, that is an industry of how do we vet the articles that are coming to make sure that they're peer reviewed and have some amount of validity to them and aren't research slop, so to speak. So that requires time, money, and effort. So do you see any way around that quagmire?
That is a great question. I personally, I'm kind of, it's hard for me to think about exactly what would be a different way to structure it because like you're saying, journals do need money, right? It's not something that they can just like freely do. Um, when it comes to publicly funded research, it is often like one of the mandates of like grants, for example, from the NIH, National Institutes of Health, to, be able to then like, once a journal has like a year or so of the paper kind of being exclusive to that journal, like they will put the paper in this repository. So for example, like PubMed, and, people will be able to then freely access it. But then it's already been like, a year or two or however long the embargo is on the paper. And so like, it's just harder to find because then you have to go back in the archives to then kind of like know about this. So like, I think that might also, again, contribute to some of that lag. But yeah, like I don't envy the people who have to try to solve this problem for sure. It's a difficult one.
Yeah. And what you were just saying, that these things eventually do become public information, but they're kind of lost in the noise, and that contributes to the 10-year lag of what does the latest research suggest and what is actually happening in practices. And I find that really interesting because, how do I articulate this? Yeah, sorry, it's not that profound of a thought. It's just the idea that it takes time, and then how can we expedite that so we can learn more quickly, but we have this journal article publication problem. And we're going a little off topic, but you recently told me you're a peer reviewer and you recently rejected a paper. And I don't think people have ever had any insight into what it's like to be a peer reviewer. I've never done anything close to that. And then also, if you want to take a big swing and talk about maybe the replication crisis and if that's touched clinical psychology at all. I know it's definitely ravaged social psychology and even some cognitive psychology, but I don't know too much about the clinical side of the house.
Yeah. I mean, I will say for the replication crisis, it definitely has touched clinical. Like it's not something that you can kind of, you'll read journals and then like you'll kind of see as the years have gone by, like, replication is kind of needed. It's one of the limitations of the study. I mean, and I guess turning back, I guess to the idea of like peer reviewing, it is an interesting process because it's not something that, you're usually paid for. And so it's something that like, it's kind of thought about as like the service to your profession. But at the same time, that means like, I'm taking time away from like writing grants, for example, which, I need to be able to kind of fund my lab and fund my research. And then I have to teach in the summer, the academic years. And so it can be tough to kind of like put all that in. When it comes to doing like this, what is essentially kind of volunteer work. It is interesting to kind of be able to read other people's work, before it's even out there. But I feel like, one of the big lines of defense against, having findings out there that maybe are not replicable, or, it's kind of based on science that's like not the strongest, is kind of this peer review system, which like just kind of as I'm describing it, like it's not perfect and it has a lot of barriers. Like, I've talked to editors before about how hard it is to find peer reviewers, because it's, there's not enough time, or, there's just like not enough of like incentive in terms of like, being able to get reviewers in a timely basis as well.
Yeah. Yeah. And I also, in my own research of the replication crisis, is there's incentives that led to it with the publish or perish paradigm of universities. Do you have any comments on how that contributes to it? Or is that pressure you face as a university researcher?
That's a great question. I've luckily had, mentors who haven't necessarily like pushed me to like have to be publishing like 7, 8 papers a year or something like that. There's definitely people kind of out there who probably do kind of face some of that pressure. I will say that, with funding, having publications is really important. And so, I could totally see why, you need those publications to be able to kind of get the grants. And like, even for tenure, like, I have to, be productive as a scholar. So again, I think it's sometimes tipped too far in that way, where, the papers are incentivized, and then we do have challenges where it's like, well, how do we produce that many in so little bit of time? Again, I guess it's one of those like, I guess, positive feedback loops, which again, I still have a hard time wrapping my mind around like a potential solution to that.
As a systems thinker, you just have to look at, from my point of view, just look at the incentives of publishing more and having positive results are what gravitate money and attention. So of course, if that's what's incentivized, logic follows that you're going to have more false positives at that point. And where do you want to draw the line? Where's the response criterion of we're going to tolerate this amount of false positives, or we're going to tolerate this amount of misses, or however else you might want to think about it? Coming from a public speaking background, when I was researching public speaking and things like that, something a lot of people are concerned about is nervousness, of how do you master your nerves and control your nerves. And I stumbled across Power Posing by Amy Cuddy. Have you heard of this?
Yes, I have. When I was in college, yeah.
Okay, so Amy Cuddy is a social psychologist, and I forgot when, probably 2014 timeframe, she gave a famous TED Talk on her findings from power posing. And power posing, for the audience, is standing, feet width or shoulder width apart, hands on hips, puffing your chest out a little bit, or just assuming any pose that you subjectively think would grant you power. And she had all of these positive results of, it gives you more power. And they were doing, I think they even did like some hormonal measurements that maybe, was it testosterone? I haven't read up on it in a while, but it's one of the casualties of the replication crisis. And I think it's a great case study of how people misunderstand science publications, and then we fall prey to whatever sounds cool or groovy. And one thing I'm big on is science is routinely very boring. Good, rigorous, profound science is likely to be very boring to most and unintelligible to most people, because they don't know research methods, they don't understand statistics, they don't have the insider trading on all the jargon. And in the case of power posing, this really easy to grasp concept of just assume a powerful position, be Superman or Wonder Woman, take some deep breaths, and then all of a sudden you're going to be more powerful. And we backed it with empirical tracking of testosterone and subjective report measurements. And it caught on like wildfire. That was one of the best performing TED Talks of all time based on non-replicable science. And we're talking about the replication crisis, all of the things plaguing publishing good results, the publish and perish phenomenon. And I think one component of it is the intelligibility and, for lack of a better word, the sexiness of the science. Of people will gravitate and want to endorse sexy science, but most science is unintelligible and boring to most people.
Yeah, I appreciate you kind of use as that example. And also, I think I do agree with you in that, it's not exactly like, I feel like as a species, or I guess as just the human condition, is we want things that are like digestible, and also things that will like solve our problems quickly.
Yes,
Just
yes.
because we are motivated, obviously, by like, short-term rewards. And so, we want something that we can kind of dig into really quickly and implement very quickly. That's seldom, at least in my experience, seldom how life works, for better and worse. And so, it's very alluring to kind of get into that. But then also, just as like you're describing, science is like iterative. Like we even if a finding is like not necessarily the most interesting, you still have to kind of test it. And then maybe in the future you find out, like, because you have like a larger sample size, for example, you'll find that like those results were not as valid as you originally thought. And like, that's just science. Like, we have to constantly be testing things. Not any one study is going to be like the definitive answer to everything, which is unfortunate because that's what we want.
Yes.
But there's always going to be a little bit of uncertainty.
Yes. And I think that problem is exacerbated with the behaviorals or the soft sciences. And I have to tell people this all the time that haven't ever been through the socials, so to speak, that if you're in the physicals, you're measuring distance, or you're measuring weight, or you're measuring speed. Those are all very tangible, exist in the physical world constructs that you can measure directly for the most part. Whereas in the behaviorals, we're measuring depression, or we're measuring trust or love or anything else that does not exist in the physical world. It's only communicated by how people state they are behaving, or state how they are feeling, and how we can actually observe them behaving. And that is much more difficult to measure, which increases the chances of misses and false positives, because you might operationalize love, trust, depression one way, and I operationalize them a slightly different way. You measure it this way, I measure it a slightly different way, and we can come to vastly different conclusions, because agreeing on what these constructs mean in and of itself is a huge discipline to master. It's not just, did this diet make you lose weight? Step on the scale. It's, did this diet improve your mental health? Well, how do we measure mental health? Like, what are we going to do? So I think that's another layer, especially with psychology, that people don't understand how complicated these disciplines are, because it's not just science, it's science of things that don't physically exist.
Yeah, I really like that perspective. I mean, and kind of to add to that, like, even just the idea of love can be so influenced by like, your own personal experiences and other cultures that we were brought up in, or, it's just, it's so tricky to be able to, like, sometimes psychology measures, for example, like they have to be studied under different cultural contexts to see if they actually measure the same thing across, people from the US versus like France, for example. Like, those are all things that you don't necessarily have to kind of go through when it comes to something more biological, and something that's like really tangible. But, we're mixing, I guess, the psychological phenomena with like some philosophy or two,
Yeah.
which I appreciate.
Well, I'm very loose with my definition of philosophy. I just typically say philosophy is the discussion of ideas, because science is empiricism, which is the philosophy of, we can discern the nature of our reality by measuring things, more or less. So that's what it is. And then with the behavioral psychology, we have to add more rationalizing to that of this is how we are measuring, this is how we rationalize we are going to measure this construct. So coming from the cog side, human factor side, one big construct is attention or attention and trust, and particular trust in automation or trust in technology. Those are the ones we were very frequently concerned with. So I want you to tell me a little bit more about measuring your construct. So you obviously deal with suicide prevention and self-injury, which to me correlates with depression and maybe anxiety. So what can you tell me about measuring depression and how that relates to possibly predicting suicide or self-injury?
Sure. So there's different, I guess, like constructs you can kind of think about when it comes to suicide. So death by suicide would be someone who self-injured and their intention was to die in that way. Then there's the idea of like a suicide attempt, which doesn't necessarily result in death, but the intention was to end your life in that way. And then there's, for example, non-suicidal self-injury, or NSSI for short. So this is when, someone self-harms in a way that's meant to do something else other than kind of wanting to die. That's not their goal. Their goal is sometimes, to feel better or distract themselves from the emotional pain they're feeling. And I know there's often some confusion, or like, we think about someone cutting, for example, as like very prototypical NSSI behavior, and often people kind of think like, well, it's the person's trying to die this way, and that's not true. Always, some people do just cut themselves or injure themselves in some other way because they want to regulate their own emotions, and that's kind of what they have found to be helpful. There's also, even like cultural differences in terms of like how these constructs are defined. So, for example, like in Europe, the idea of self-harm is something that's often studied more frequently. So self-harm is defined as like the combination of a suicide attempt or like NSSI. So either of those kinds of behaviors would be considered self-harm more broadly. And again, there's a lot of debate about, how we should differentiate these things or not, because they sometimes share overlap. And even clinically, when I've met with clients sometimes who, for example, like are cutting, they won't be 100% sure whether they were doing that because they wanted to die or just feel better, or a little bit of both. So, it kind of reflects the complexity of these behaviors. When it comes to some of the most significant risk factors for this, depression is definitely one of them. Especially, for example, when it comes to like children and adolescents, like self-harm behaviors like suicide attempts and NSSI often occur when a kid is depressed. And so, there's a whole lot of risk factors for these kinds of behaviors that we don't necessarily have to go into, but it is a complex picture because, not everyone who makes a suicide attempt or engages in NSSI does it for exactly the same reasons. And that kind of adds to the complexity of like, how do we understand and predict these kinds of behaviors?
That's really interesting because I haven't addressed this data myself, but I've just heard it in the pop sphere through other podcasts and commentators that women are more likely to attempt suicide, but men are more likely to succeed in suicide. So the suicide rate is actually higher for men, whereas the suicide attempt rate might be higher for women, but they fail. So I didn't know if you had any comment on sex differences or any other demographic differences between attempts and success of suicide.
Yeah, so I will say, in terms of the death by suicide rate, men do die by suicide more often than women. There's many different reasons for why that might be, and women are more likely to make an attempt. I think one of the things that kind of has popped up in the literature before is this idea of the different kinds of methods that people use, men and women. So, for example, men often use kind of firearms as an example, and that has like a higher lethality rate than, for example, overdosing on Tylenol. Because, with an overdose, it's not going to immediately end your life. You will have like obviously a lot of physical symptoms, and then during that time you might find support or something like that. And so that's one potential reason. And then, there's social factors when it comes to, even thinking about like, men are more likely to own firearms versus women because of like, at least in, we're thinking about like some particular cultures, firearms could be associated with like masculinity, for example. And so that might be, one of the reasons why we have like this greater access for these more lethal means among men than women.
That's exactly where my head went, that men are statistically more likely to own a firearm. Why? I don't know. But at least here in America, I would accept that as a ground level truth that most firearms are owned by men. So then when it comes to suicide, a woman's less likely to have that as a readily available means, whereas men do. And then is there any difference between, I want to address this delicately, but the people who make a big show perhaps out of their suicide with like in a public space, like if they're on a building or on a bridge, and then they get talked down to not to do that. Is there anything that you can tell me about the literature on that? And then also, is that considered a suicide attempt? Because they didn't actually self-harm at all. They were just very much on very much on the edge of it.
Yeah, that's a great question. So, there are, I guess, these distinctions as well between like an interrupted attempt. So that would be when someone kind of stops you when you're about to engage in a suicide attempt. That would be an interrupted attempt. And then there's kind of the idea of like a self-aborted attempt where you stopped yourself. And those are also, considered kind of like high-risk behaviors that obviously could still result in someone's death. But, so for whatever reason, something has stopped them. When it comes to like where or like the kind of method that people use, I feel like that's a harder question because, it's hard to understand sometimes, for example, if there's a bridge that someone, has for whatever reason has an emotional connection to, and that's kind of why they feel like they have to end their life there. And so it can be hard to discern exactly why someone might kind of do or try to end their life in that way. Um, but I mean, there's been a lot of public talk about how to address these kinds of places. So, for example, like the Golden Gate Bridge in San Francisco was a place where people die by suicide quite a lot, and so over the years they talked about how to kind of prevent this, and they put up netting underneath the bridge now. Which I think I think it really speaks to the importance of kind of taking like a more public health approach also to preventing suicide, not just like individual therapy as like DBT as like the solution. I think we're going to need kind of like these multi-level interventions. But anyway, I digress.
No, that's great. That's great. I do have one comment. Let's rope some philosophy into this because one of my
Sure.
favorite books I've ever read is Brothers Karamazov by Dostoevsky, Russian author. And in it, one of the main character's mothers kills herself by jumping off a bridge. And this is kind of before the main narrative takes place. It's him setting the stage with the background of how these 3 or 4 guys are brothers with different mothers, all from the same father. And Dostoevsky very deliberately wrote this line of, had it been less picturesque, perhaps fewer people would have jumped. It was something along those lines. It's been years since I read the line, but I remember it struck me that he very much went out of his way to write about, dare I say, the tragic beauty of the suicides that occurred at this bridge. That there's this, and I'm roping this into what you're saying, that if somebody has some sort of tie to a place, that it can be very complicated to discern why they might kill themselves if there's some interpersonal emotional connection to said place. And this is something that Dostoevsky apparently was onto way back in the 1800s, that there's this perception of people exercising some amount of control over their lives. So their lives are spiraling perhaps, and they want to exercise some amount of control and they want to go out on their terms, but they're not going to do it ugly. They're going to do it pretty, i.e., give their life some sort of narrative, some sort of grandeur of a picturesque place to die, which I think is a very interesting concept that's only coming from literature. I don't know any science on this, or what you just said. Maybe it's not pretty, but it's emotionally resonative of there's some connection to this location, and that really obfuscates the nature of suicide.
Yeah, that's a good question. I feel like, with the idea of like beauty, I think again, natural beauty, for example, if we're thinking of San Francisco, I've been to like the Golden Gate Bridge myself many times, just because I used to live in California. But it is a very beautiful place, and you can kind of develop an emotional connection, even though like I didn't grow up there. It's still there's some sort of sense of, I guess, awe, at least for me, when I think about like, that area of the world. And, I could see why, you know, that kind of builds some sort of emotional connection to it. It's just like, we're humans and we've developed to kind of appreciate beauty and nature. And so that could, build this emotional connection to a place, even if you've never really like if it's not necessarily like meaningful, because like nothing particularly meaningful in my life happened there. It's just like the way it looks, that really um, kind of resonates with people.
Yeah. Yeah, that's so interesting. So I want to take a step back for a moment because we talked on this a little bit, and then you also brought up the public health approach to suicide prevention. So one thing is you mentioned DBT and CBT, and then you also mentioned that we don't have a good understanding of how to prescribe therapy necessarily based on who would benefit the most from any given therapy. And that's a really rich topic I want to dig into. And then after that, I want to start digging into the public health approach. So with the therapies, can you list a couple more therapies, whether you've trained in them or not, just ones that people might experience if they are feeling depressed or anxious or any other, they call up a local therapist. They don't even know what school of thought that they're getting therapized in. So what are they likely to come across? And then let's dig into the efficacy of these different therapies, where is there any prediction based on any demographics of if you're a certain age or sex or culture, perhaps a certain therapy works better for you, or whatever your mental affliction might be. So you brought up, I think OCD. We've been talking about suicide prevention a lot. So if I come to a psychologist or a therapist with a specific mental ailment, and I'm a white man that's 32, to what degree can we leverage that information to take a best shot at which therapy might work best for me?
Yeah, that's a great question. So I'll start off with, I guess, listing some of the therapies, with the caveat that, again, I feel like even though it's important to kind of know what these are, it's always helpful to kind of talk about what, like, based on a person's kind of like difficulties might be, to talk with the professional about what might be the best course of action. But we're like, I mentioned CBT, and a lot of the treatments I've kind of, I'm most familiar with are kind of based on that. So for example, CBT is quite effective for depression and anxiety. We're thinking about like OCD, which is no longer considered an anxiety disorder. Um, OCD, it's the most effective kind of therapy for that would be exposure and response prevention. So you're trying to kind of work through with people, in terms of like what their compulsions are, what their obsessions might be, and trying to help people kind of stop themselves from engaging in the behaviors, so that way they can kind of challenge the obsessions that they have. So that's, kind of like the frontline treatment for OCD when it comes to psychological interventions. Um, when we're thinking about trauma, there's actually a few that, people could kind of potentially choose from. So there's prolonged exposure. So this was developed by Dr. Edna Foa, along with exposure response prevention. The idea that, when we have a traumatic experience happen to us, and you develop trauma symptoms, like, think prototypical PTSD kind of situation. One of the things that kind of maintains the symptoms of PTSD is our avoidance. Obviously, we're all human beings. We want to avoid painful emotions and memories. And at the same time, that kind of creates a positive feedback loop, which then really feeds into some of the symptoms that we might experience as someone who has trauma. And so there's prolonged exposure. There is cognitive processing therapy that's more focused on the idea of challenging some of the beliefs that kind of resulted from the traumatic experience. And then there's like kid versions, which is something I'm trained in. It's called TFCBT, trauma focused cognitive behavioral therapy, which kind of mixes a little bit of both in there. But you're working with the kids, you're working with the families to help, support the kid who has, experienced some sort of traumatizing event in their life. It is now experiencing these PTSD symptoms. Um, there is, something I'm less familiar with, but there is psychodynamic work or psychodynamic therapy. This can come in many different flavors, but the idea there broadly is that you're trying to address kind of these um, unconscious kind of like conflicts that you might have between like the needs that you have and the wants that you have, and then not being able to kind of get those in your life for whatever reason, and also how the patterns you had in terms of like relating to other people might impact your relationships now. And so like that's a lot of the psychodynamic work and psychoanalysis, which kind of even preceded that. You can kind of think about Freud and the couch as kind of like very prototypical psychoanalysis. But again, a lot of these actually therapies kind of came from psychoanalysis. And so we have Freud to kind of thank for being able to kind of popularize the talking cure, which actually came from one of his patients, that term. But yeah, I think I kind of want to leave it there because there's a lot more, but
Yeah, I think that was
not to
a great
overwhelm
introduction.
people.
Yeah, I think that was a
Yeah.
great introduction, and I really appreciate the cap you gave of it, that a lot of this came from Freud. And one of my pet peeves as somebody who studied psychology and worked as a cognitive engineer, human factors engineer type guy is that they always say, "Oh, are you psychoanalyzing me?" And they think they're being smart. And I'm like, that was Freud. No one actually does that anymore. It's evolved past that, and psychodynamic therapy is what it is. And I don't want to digress on this too much, but I guess it suggests, dare I say, the genius of Freud, that he discovered a lot of things without empirical methods necessarily. And even though people don't practice psychoanalysis anymore, it did lay a lot of groundwork for the therapies we do practice today.
Yeah, I mean, I think it really speaks to the importance of having like, important like practical experience, but at the same time, right, like there were obviously problematic things about Freud and his
Really?
approach
I
to
didn't notice.
his approach to supporting people. But again, it's it is what it is with that. But again, I do think it's important to still credit him for being able to, for whatever reason, able to popularize and kind of disseminate the idea of talking to someone and building a relationship with someone as kind of like transformative or curative for mental health problems. And that's something that we often talk about in terms of therapy. Like what are some of the common threads that make therapies generally about as effective as one another? And one of them is kind of that relationship that you have with your therapist. I think that's really important because if you're a client, you need to be able to feel like supported and still kind of nudged, obviously, like to expand the way you're kind of maybe thinking about something or try something different. But I'm of the opinion that it's important to have a therapist that can kind of meet you where you're at and also nudge you forward to whatever the goals you might have are.
So that leads into the next questions I want to ask about meaning. So we've already touched on a couple different threads, and I want to see if we can weave them together, because I'm really keen on meaning and particularly the meaning crisis, because it does seem that a lot of the data suggests people aren't content with their lives in the West. The suicide data and depression and anxiety data suggest that things have been going downhill and are continuing to go downhill on this front. And that's why I'm setting out on a lot of these projects and talking to people such as yourself of what can we learn about these things, because I really want to see and popularize and make these tough topics more accessible and understandable to the masses, because they don't have that insider trading knowledge of what's going on at research universities that are informing a lot of these psychotherapeutic approaches. But that's only half of the equation, because of what you mentioned about the public health and what I would consider more of like this community driven effort in reducing anxiety, depression, self-injury, and that how do we give people meaning in their lives so they think that the juice is worth the squeeze? So what connection is there between meaning in life and suicide and the self-injurious behaviors you come across?
Yeah, that's a great question. So generally speaking, research does suggest that, people who have a lower meaning in life are at greater risk for engaging in suicidal behavior. And just like kind of the opposite is also true when it comes to having, feeling like you have more of this meaning in life. It does protect you against, suicide, but also not just that, it does protect you against like other kinds of mental health problems like depression and anxiety. So it's generally something that, we want to have. Um, and if we're kind of thinking about like this from a public health perspective, one of the things, and, we can talk about this in more detail, the idea of like where people kind of get that meaning in life, it can be a very philosophical question. And at the same time, it is something that has been, kind of weaved into different kinds of therapy. So for example, DBT is all about, trying to figure out building a life worth living. That was kind of one of Dr. Marsha Linehan's kind of things that kind of emphasizes in the model, and actually her biography is named that. And so it really speaks to how central it is to, thinking about suicide. But when we're thinking about, for example, DBT, you try to understand, some of the values that someone has, like what is it that's important to them, and then thinking about ways to kind of move towards those, which we define as goals. Like, right, if you have the value of friendship, thinking about like how do you kind of live that value? Do we like try to connect with people outside of the workplace, for example, because maybe people at work aren't so great to you, things like that. If you're thinking about more of a public health concern, like a public health approach to suicide prevention, maybe the idea of trying to build or facilitate ways to, I guess, have people be more socially connected might be a helpful approach. Well, I do think it's interesting, in this age of social media that, where maybe in some ways more connected than we ever have been, and other ways more disconnected than we ever have been because of the way social media kind of operates.
Yes, that's the sick irony of modernity, that we have the ability to be so connected, yet it's driven us into isolation. And it's, in my opinion, very directly linked to the meaning crisis that we're experiencing. And there's one distinction I want to make, because we keep on saying meaning in life. And this is something I've been trying to theorize upon myself and learn what others have to say about it, is the distinction between meaning in life and meaning of life. Where I'm very much a meaning in life thinker, because meaning of life is this very big philosophical question. And it usually boils down to something or someone giving it to you or telling you. So you and I both come from religious backgrounds that informed us, this is the meaning of life. This is what a good life constitutes as. Not to say it's entirely restrictive. Definitely is a lot of bandwidth within that framework to find your meaning in life. But back to the Linehan philosophy of build a life. Was it build a life you're worth living, or build a life you're proud of? Yeah, worth living. Because I've said this before, that if you frame meaning as something to be found, so it's like people often say, I need to find my meaning or find my purpose, that implies that it exists apart from you, that it's already out there somewhere and you just got to go find it, which opens up a whole can of worms, in my opinion, of how do you know when you found it? What does looking for it even mean? Then people say they lost it, and I don't know what this means. Whereas build your life, that is 100% an agentic approach that allots for errors, and doesn't necessarily forgive passivity. That if you want a meaningful life, you must build it. You must, this is my philosophy coming out now, that you must execute your agency and then build in a direction that you think is worthwhile, and learn and iterate as you go. That you might set out on some path and realize, oh, I actually don't like this. This isn't working out. And change course accordingly, depending on whatever feedback you receive, or how what levels of contentment and meaning you define that you have for yourself. So tying back into Linehan and also with the ACT therapy, is I'm very big on value-driven lifestyle, that we as individuals, in junction with our human nature, which we can talk again, like the evolutionary needs of humans, and with our cultural influence. I think all three of those need to thread together. That you are an individual with preferences and values that are heavily influenced by the fact that we're evolved beings and you were raised in any given culture. So my approach is to account for all three of those factors and see what do you want to value, or what values do you want to spend your life pursuing. And values are directions, I often say. They're very abstract and they're never done. So if you frame it as I need to find my purpose, that means you have it or you don't, and then you're done or you're not. Whereas building your purpose it's the project of a lifetime in any given directions you choose. But I add the concrete back into it with mile markers or milestones or goals that I want to head in this direction of friendship, of community, of intellectual pursuits, of physical fitness, mental health, what have you. But then to set concrete goals along the way so that you can have that feedback loop of saying, okay, I pursued in this direction and here's something I accomplished. Now what? How does that make me feel? Or do I find that meaningful? And how do I want to change direction accordingly or continue in said direction?
Yeah, no, I really appreciate that. I feel like it aligns like pretty effectively with the idea of like how ACT, for example, acceptance and commitment therapy kind of thinks about goals and values. So in ACT, I know that they often use the compass versus like the Google Maps metaphor. So when you're thinking about values are kind of like your North Star in terms of like, this is kind of where I want to go, but it doesn't tell you exactly how to get there. If you're thinking about like, Google Maps, for example, it tells you exactly how to get to a particular place, and those are your goals. So, you're going to get to Walmart, for example, by taking all these exits or whatever. And so that's kind of one way to think about, the idea of goals and values and how do we kind of build that life we want for ourselves. I will say, when we're thinking, at least in my experience, sometimes people have had so much happen to them that it can be really hard to discern what it is that they actually value. Or even had time to think about it because they're struggling with so many different things. And often a place that's helpful to start could be, social connections, because we do have what Baumeister and Leary, these psychologists in the 90s, they argue that we have a need to belong, which I think, some of the research does suggest that it brings us a lot of meaning when we have different connections with different people.
Yeah, that's what I would rope into we're evolved beings part of that triad. And can you dig a little bit more into the social connections and the need to belonging, how that ties into meaning in life, and then how that ties into suicide prevention?
Yeah. So the idea of, and I guess from an evolutionary perspective, folks, we evolved to need social relationships, or I guess our ancestors, the ones who were the most successful and the ones who kind of passed on their genes, I guess you can put it that way, were the ones who had like this additional support from other people. And so over time and generations, that kind of drive is something that kind of became very central to who we are as people, as human beings. And so, we find social connections, very rewarding. And it could be one of the reasons why, when we find it so, I guess, meaningful. And again, we can try to define that word, which is, it's hard to do sometimes, exactly what that might mean. But we have like this deep sense of maybe like calm or joy that we feel when we connect with someone in some particular way, whether it be romantic or platonic or whatever kind of relationship that you might have with a person. And, the research does suggest, that there is just something very, I guess I maybe use the word special about like a relationship and how it can affect us, like in terms of mental health. Like, there's research to suggest that having more social connections really does impact even our physical health, as an example. Or when we experience social rejection, how it impacts our ability to like problem solve very effectively, or like, it really causes us to have like very strong negative emotions. And so, tying this back to suicide, sometimes when I, when I've worked with people, like one of the precipitating factors for self-harm behaviors is often when people experience rejection or feel like lonely or this lack of connection with someone else. And so that's one of the things that, we try to target pretty early on, in terms of, how do we find a way to connect you with other people if that's something that you are really craving or value. Because again, that's like, it's going to also fall in a bell curve, right? The idea of like, some people might need more connection versus others. The idea of like extrovert versus introverts, for example, in terms of like what the relationships look like, or like the amount of relationships that you kind of want to have. So you have to kind of tailor that. But I think generally the idea is that there's something very protective and helpful about having social relationships. That's very central to suicide prevention as well.
Yeah. And I like what you said about tailoring it specifically, because it's not necessarily the quantity of relationships you might have, but the quality of it. And not quality meaning good or bad quality, but the quality of like the nature of the relationship. What do you talk about? What do you do for fun together, et cetera? Because that's something I've struggled with, especially as I've, let's say, become more niche in my interests, that I need to find more people that share these interests and can tolerate me monologuing on one topic for 10 minutes, because then I want to hear their 10-minute monologue in response. And to me, that is a quality discussion. That's the when we have our private discussions, that's very much how it goes from my end, I think, Robert. And so even if you put me in a room full of people, I can still feel that loneliness if I'm not connecting with them on any given topic or interest or anything else. So, but on the flip side, I do find a lot of meaning in being a community member and serving my community. So even if you threw me in a pack of people where I don't necessarily connect with them, but you gave me a chore or a task to do and say, do this to better this group of people and support it, like your local community, then I'd be very tolerant of that. And I would really enjoy that. But again, that goes back into the quality of those relationships. So in that situation, I'm not there necessarily for friendship. I'm there for this much more abstract notion of communal relationships, that even though I might not be directly connecting to any one person very deeply, whereas when I talk to my inner circle friends, yes, we connect on some very niche interests or some very shared life experiences that not a lot of people can relate to. And that gives me that sense of belonging, that sense of, oh, there are others like me. And then to close out my point, or to segue into another point, is in the age of social media and screens, the irony being that we can be more connected, but it seems a lot of us are isolating more, and we're lacking a lot of these intentional relationships. Do you have any experience with that with your clientele?
Yeah. Well, first off, I really want to appreciate you kind of sharing your own experience, because I feel like that's a helpful way to kind of make what I was saying very concrete in terms of, everyone kind of has like a different definition of like what that connection might look like for them. And so that's important to kind of explore with clients for sure. When it comes to social media, I mean, it's definitely like a double-edged sword, when it comes to, how helpful or harmful it could be. For example, I've had clients I've worked with who with social media, if you're like kind of, you mentioned, like they had very niche, interests, or like, there were other people around them who were just like really unlike them or kind of dislike them for whatever reason. And social media was a lifeline actually in some ways to kind of connect with them. But then at other times, right, when we're thinking about like, when we're making various like, quick comparisons to other people, like we see the very pretty pictures of someone's vacation and then you're kind of struggling there. It can be very demoralizing to kind of see that, right? Like you're having all these like social comparisons. And sometimes when what we see on a feed is like a very tailored version of someone's life. And so that's important to kind of keep in mind when we're thinking about, how social media can be very helpful for some people, but also harmful depending on, what we're kind of doing with it. I remember reading a study, and I might be misquoting it, but I remember they kind of looked at how much they were like someone was interacting with like posts and things like that. And they found that people who were like, making active comments on people's posts and kind of engaging in that way, actually that was related to like more positive mental health outcomes than some people who were just kind of like endlessly scrolling. And so again, a lot of things kind of go through our minds where we're kind of like endlessly scrolling through content. Maybe our lives should be this way, or like, why am I like so unhappy when everyone else is unhappy? So those kinds of thoughts could be very unhelpful because, we're not actively really connecting with anyone in particular. It just kind of feels that way for a short moment. And then kind of like the social comparisons kick in.
Interesting. Yes, I think that's common knowledge, but we always forget it. That you're looking at the highlight reel of anybody's given life. And this is something I stress to people too, given my expat life living on a tropical island, and I'm posting hiking videos and pictures and birthday speeches and whatnot. But they're not seeing all the dark times I still continually have while living this idealistic life on social media. So that's always something to remember. The other thing I want to talk about social media and the double-edged swordness of it is it's greatly empowered me to maintain relationships with people I no longer physically see. I remember I was walking home one night after a dance social, and I was FaceTiming my mom while I'm on an island in Europe walking home, and I could see a picture of her and talk to her, which was unfathomable when I was 10 years old and we went out of state and had to set up a long distance line and had to stand in a very specific spot in the house where the signal was to call home. So to see the technological advancement of when I was 10, I'm in the same country, just a different state, and I could barely talk to my mom through the phone. It was a lot of work. And now as an adult walking in a different country through alleys, I can see a picture of her while I'm talking. And it's just not that, it's sharing memes with any given friend group. And I can text them and go, or whenever there's a news article or something relevant to their career, I can send it to them and maintain that. But then on the other hand, it's an addiction where you can just sit and scroll and isolate yourself from physical connection of, no, I still need to get out and make new friends and maintain friendships with the people that are physically around me, not just the relationships I have previously cultivated and want to maintain emotionally.
Yeah. I feel like I very much feel the same way, especially as someone who's like moved around a lot, for a variety of reasons. But like, it's been nice. I've been able to kind of like, cultivate and still nurture relationships like even from high school because I've had this, you know, quick access to someone like, with social media. And just kind of like as you're saying, like when I was younger, I would move from state to state. And like when I was in elementary school, there was like really no way to connect with someone unless I was writing them letters. But like, I mean, I was 5 and like I was gonna be writing letters. I barely had any kind of attention span then. So it's like it just has made it there's a lot of pros too in terms of like, having social media and maybe more about thinking about how we use it as a tool that can be really beneficial to building that meaning and building those connections with people.
Yeah, it definitely feels like it needs cultural practices and guidelines on of this is how we can use it to better ourselves, but here is where it can go wrong very quickly and cause problems. And at this stage, I'm very much more conservative of like let's ditch social media. From my point of view, it seems to have done more harm than good, especially with the younger you are, it seems to affect you worse because of the lifestyle comparisons and etc. And I also think it's allowed us to be more picky in relationships. That what you mentioned earlier, that if you do have a niche interest and nobody in your immediate surroundings shares that interest with you and you can't plug into it anywhere physically located location wise, there's usually a virtual space for it. But then if you do that too much, the minute somebody digresses from that point of view, it's much more easy to cut them off because there's somebody else in that space that you can access or gain access to from anywhere in the world and continue that dialogue. I think this is maybe where like politics can come into a little bit too, where you're able to just niche down so much and become a Puritan of whatever standards you want. And the minute somebody transgresses against that, then you can axe them. Whereas if in bygone eras where you can only associate with the people physically surrounding you, groomed a higher degree of tolerance and probably better social skills too, of how to interact with people who disagree with you or don't share similar interests, and how you can share that time together a bit better. Have you heard anything in that world?
Yeah, I mean, I feel like you're kind of like, uh, kind of describing like the idea of like echo chambers, for example, where we're like we only like associate, like we start off by like, really only associating with like particular perspective, and then the idea is there, we really identify with it, and everything else is kind of wrong, or just like something that's like not necessarily what we agree with, and so it's just like, well, whatever. Um, I feel like, again, I think it speaks to the idea of how social media can be both hurtful and harmful. And so it'd be helpful to think about, you know, if it's like what we find ourselves in our echo chambers, and, if we're tying this back to the values and having relationships, if I was seeing a client, the idea would be to kind of explore like what are the pros and cons of only associating yourself with people who have a particular perspective. Is that causing you distress in any way? Or, if there's a way to kind of maybe challenge, um, or just kind of invite different perspectives to kind of be able to hear, um, what another person has to say, because we could have very different opinions but also still be really good friends about something. Like, I mean, no one person's ever going to have the exact same opinions as another person, so disagreements will be part of just having a relationship. And so that would be important to still kind of navigate and be able to still to kind of sit with, if we're thinking about, relationships being something that's very meaningful to us.
Yes. And I think, this is complicated and I don't know how to articulate it precisely, but the ability to weather disagreements and arguments and learn how to get along stands a good chance at deepening that relationship, at making those bonds stronger. Because I think of my best friend that I've known, man, I think 20 years now we've known each other, and how comfortable I am disagreeing with him. Now, he and I debate all sorts of topics and share all sorts of opinions and whatnot, but we've cultivated such a deep understanding of one another and such a shared respect for one another that we allow each other to be wrong, so to speak. That if God himself said that he was doing it wrong and told me, I'd be like, okay, that's fine. He's still going to do it, or vice versa, because we care about the friendship and the relationship so much, and that we've forgiven each other so much for being wrong before, that it's deep into the friendship that we go, okay, it's his turn now, but next time I'm going to be the one that's making a fool of myself. And like having that level of trust, and to me, what seems like a sophisticated friendship, that we're allowed to disagree and allowed space to think out loud and be wrong. Like we do a very good job at letting the other person think out loud, perhaps say something completely ridiculous, offensive, what have you, but it is that very fraternal bonding. And it's made it one of the most rewarding relationships of my life. But I don't think I could ever have done that if I didn't share such physical proximity with him for so long, right? This is somebody went to school with, lived together, managed to go to grad school with for a semester, and have kept in touch over 20 years. So since we had that physical proximity as the foundation of our relationship, the virtual proximity has been the icing on top. Whereas I'm fearful that now people aren't getting that physical side to the relationship, where you need to be together, you need to annoy each other and deal with it. And then you use the virtual as the keep in touch and the send memes and continue that lifeline on the chance that we ever are physically together again.
Yeah. I think it speaks to the idea, and I'm glad that you kind of have that kind of relationship with your friend. I think it speaks to if I'm thinking about this from like an evolutionary perspective, right? Like we are, and through our evolutionary history, like what we know, what we were exposed to is physical relationships, like in the physical space with someone. Like that's kind of what our genes remember, if I want to kind of use that kind of phrasing. But
Yeah.
I think that's I think that now poses a challenge for us now because of like, our minds are not necessarily adapted to the idea of like what social media can do. And so it can be harder, I think, to be able to build those kinds of relationships in some ways because what you're describing, with the proximity piece, that's the kind of how all our ancestors, that's how we built our relationships is with like someone there with us versus like thousands of miles away over a screen where you don't have necessarily like, if you're not FaceTiming or whatever, you don't have like body language to kind of read or like, um, it's harder to kind of read it between the lines as an example in terms of like what that person might want or need. Um, so again, the social media piece maybe could be more helpful if we potentially were focusing more on being able to build some like physical spaces for people where they can kind of, maybe create relationships like similar to the ones that you have had. And then, obviously because time and space is not always on our side, you could kind of like switch over to social media as a way to kind of keep that relationship going. I feel like that's in many ways how I've kind of navigated social media. Obviously, sometimes I still find myself doom scrolling, for example. I might be a psychologist, but I'm not immune to that. The idea of, I've had friends from high school I've known for 20 plus years. And like, we keep in touch in this way, sending memes to each other or whatever over social media.
Yeah. I think also with social media and then the physical proximity component, and I've noticed this since I've moved. So we've both moved states and countries or whatnot and tried to keep in touch with the various relationships we've cultivated in the past. And I've noticed there's a distinct difference between briefing my old friends on what has been happening in my life versus sharing my active life with somebody. So when I'm only sharing the memes or only FaceTiming them occasionally, it's always a catch up of this is what's going on in my life. And it's meaningful and I don't want to downplay it, but I'm not actively sharing my life with them anymore. We're not creating memories together. And that to create memories together, you need that physical proximity to go do activities together. So that's pretty much what I've boiled it down to is you just need to go do things together. Whereas if it's only the briefing, then the next time you talk, it's just another brief and talking about the last time you talked, which can get very dry and monotonous and lack meaning very quickly, in my opinion. So one thing I do is I try to share conversational topics with certain people, like one friend and the same best friend, we share books. So he tells me to read something and I'll read it so that we have that something of a shared experience together so that we have something to talk about, not just briefing each other on what's been happening in our lives.
Yeah, I feel like that's this is like a lot of what we do in therapy is when we're thinking about like how to build relationships. One of the things is kind of having those shared experiences in some way, even if you are not like in the same place. So it sounds like, you're trying to have an experience with him, even if it's like kind of remotely, like you're able to kind of still dig into something that's like both interesting to both of you and, be able to kind of build something off of that. Which again, I think it speaks to some of the limitations that, social media kind of might have for us as, beings who kind of evolved to have relationships in person.
Right. Interesting. So we've been going on at length about the importance of relationships. And one thing that you touched on and we digressed is the effects of losing relationships. So you said that it can be very emotionally distressing and can even affect, I think you said something about like your critical thinking or problem solving skills and affect your memory. Can you tell us a little bit more about that?
Yeah. So, I when I was kind of mentioning those things, I was thinking of like Baumeister's work, Roy Baumeister. So he's known for a lot of different things like ego depletion theory and all those things. But um, some of his, I think I personally found really interesting work is, and his kind of team is like what happens when someone is rejected socially. And, they've done kind of one of the things that I kind of based my dissertation on was like this study that they did, I think it was like the early 2000s, where they They had people take personality tests, and these people were kind of randomized into one of three conditions. And this personality test was kind of like a sham. It wasn't actually real. One of the conditions was, that you're going to end up alone for the rest of your life because you just won't be able to have relationships, which is kind of really, really sad kind of feedback
That
to give
sounds
to
like this
someone.
happened before IRB approval.
And then I think the second condition was something horrible might happen to you or something like that because you're potentially accident prone. I can't exactly remember the wording, but it was something completely unrelated, like something net bad happening to you, but it was completely unrelated to, some sort of social situation. And then the third condition, I think, was something like very positive, but had nothing to do with social relationships. And what this team found was that the people who, were randomized to like the condition that, that they got the rejection, the social rejection kind of potentially happening in the future, they were just like much less able to do, I think it was GRE questions. Like they scored much more poorly, after kind of being exposed to this. So GRE questions, yes, are not something we're doing every day, but I think it kind of speaks to the idea that like, problem solving abilities, just like they really take a hit. And then something specific about maybe the idea of losing relationships that affects that very differently than it does like maybe just getting kind of general like bad news of like, I got a bad grade or whatever. But again, it was kind of like an interesting finding to me because again, just I think really highlights the importance of social relationships because, we are a species that evolved to have social connections.
Yeah, that's really interesting. And I know in general, when I'm distressed, my critical thinking goes out the window. And I don't even think it's my critical thinking goes out the window as much as my focus does. That I can't focus on the problem at hand because whatever the distressing event was keeps permeating my brain. And that's where my thoughts are going instead of whatever problem I want to solve. And then it's especially bad in depression episodes related to relationships, in particular romantic dating relationships. I've noticed that when all you can think is like all of the I should have done this type thinking and what is she doing now type thinking, et cetera, et cetera. And that really, it grates on you because I know I need to work on myself. I know I need to solve problems. It's done. It's over. But that, I guess it's the executive functioning is very much handicapped because of this. Losing a relationship sticks with you and really, really permeates your thinking in a way that getting fired or failing a class or what have you doesn't, because of
Yeah.
whatever this evolutionary need to be a part of something and be liked by somebody or chosen by somebody.
Yeah. I think the reason why it might be I guess like that situation might be particularly special for people is because since we have this need, right, we need to find a way to, I guess our body or, our survival needs like depends on someone else kind of being there. And so we need to be especially attuned to that. And a lot of, the social skills we have, some people even argue some of our cognitive abilities developed or selected for only because we needed them to be this sophisticated to have the kind of relationships that we have. And so, we're able to problem solve, the way we can, maybe because we needed them to have really strong relationships. And so, when that's kind of gone, you either recognize that, we need to work on ourselves or, our survival is just kind of like endangered. Granted, that's like a very maybe primitive way to think about it, but again, that's kind of where this potentially kind of came from.
Right. That brings us some quote I've read. I forgot who said it, but we have, how does it go? Like we have Paleolithic brains. We're operating in medieval institutions and have godlike technology. So something is bound to go sideways here. And I think tying this into the social connection that modern life in the West has afforded, not directly needing those relationships, that you are better able to cover your baseline physical needs by yourself, such as get a job, get a house, and ideally live somewhere safe, so your physical body is safe from danger around you. And then that decreases the need and desire to go out and seek relationships because you don't have those physical threats pressing on you as much. Tie that in with the addiction of the godlike technology. And this is what's leading to the isolation. And what I want to get back to a little bit is the suicide rates increasing because we are constantly, or if social connection is so important, it seems like modernity is waging a war against us having it through these addictive technologies. And it's a horrible thing. And I know my mind, like I've been depressed multiple times in my life at this point, and it's not fun. And it does take a lot of effort to dig yourself out. And it makes me much more empathetic for the people who aren't able to dig themselves out, that do end up committing self-injurious acts or killing themselves. So this is the most dangerous question I think I'm asking today is, have you ever had a patient lose their life to suicide?
Yeah, and I appreciate you asking that question. I have been really fortunate that it hasn't happened to me. I've definitely met clinicians who have. I have had clients who have made attempts. I mean, one of the what I specialize in is helping people who have self-injurious behaviors, and one of the most robust predictors of whether someone will engage in self-injurious behavior in the future is whether they've done it in the past, which is kind of like a psychological phenomenon. You know, your past behavior predicts future behavior. And so I've definitely had clients who have made attempts before, serious ones too. And I remember the first time it happened, because it's happened a few times. The first time it happened, I was still like very early on in my career, and it was like pretty upsetting to me because and it was, I guess, a really interesting time in my life because I was like transitioning to a different like position. And so like I wasn't going to be able to know what happened to this person. I just knew that like, you know, he had been admitted to a like intensive care unit. So he was like very critically ill. And I remember the last time I had seen him, which was a few months ago, he wasn't actually someone I saw regularly. I was kind of covering for a coworker. Um, you know, he seemed like someone who, you know, was like doing okay. Yes, he had his struggles with like some like pretty serious like mental health symptoms, but like overall he was managing pretty well at that time. But it had obviously been a few months since I last saw him. And that did weigh on me for a while in terms of, you know, could I have done something? Should I have done something differently? Should I have seen something? Um, I think as over the years, as I've kind of, you know, gone on in my training and like, you know, learned about all the risk factors and learned how to do therapy, a lot of the things that I do now when things like that happen is, you know, trying to use some of the skills I've learned from DBT, for example, the idea of like radical acceptance. You know, I think people sometimes have this misconception that accepting something is like, you know, is saying if you're okay with it or like validating that it's like okay that these things are happening. Um, I think, you know, when I think about acceptance, at least from DBT's perspective, is the idea that we are trying to focus on the things that we can control and trying to, you know, figure out what we can do to address the situation and try to accept the things that are not are outside of our control. Like, you know, as much as I would sometimes like, I can't be with a client 24/7. And, you know, even if I do send someone to the hospital, it, like if they are like, you know, their goal is to end their life, that might not be enough to kind of stop them once they get discharged. You know, people might not be super truthful about, you know, how at risk they have been. And that has happened to me before. Like, you know, I've made safety plans with people and they're just like, you know, I'll be able to use it. And then they either don't use it because they weren't telling the truth, or, you know, they just didn't realize like how much distress they were in. You know, none of us have perfect insight into our minds as much as we would like to think we do. And we don't always know how we'll react to a certain situation. And so, that's just something that I have to be able to like sit with, is that, you know, there's going to be a lot of uncertainty in everything that I do. And there's only so much that I can do to help someone build the life that they feel like is, you know, worthwhile. And I, you know, sometimes just, you know, have to hope based on everything I've kind of learned and, you know, done with the person that it'll be enough to kind of, you know, keep them safe. but I can't ever be 100% sure.
Wow. Thanks for sharing. I think I mentioned this at the book beginning that people respect and appreciate and want to help in these dark corners of the world, such as suicide. But the very few people are willing and able to get down on their hands and knees and work right alongside the people that are suffering from this, because it takes such an emotional toll. And you express it greatly that not even losing somebody, but somebody attempted and had to be hospitalized took its mental toll on you. So how do you, and also if you could give us some insight into what do other clinicians do, or what's common knowledge to you all in the discipline about enduring these dark periods in people's lives, and they come to you for help. So you're trying to be empathetic and be open and warm, but not to get your emotions too wrapped up into it either, so that if anything does go south, that it doesn't devastate you too bad.
Yeah, that's a great question. So, I mean, as because I kind of like, work in the circles of suicide prevention. I mean, like I mentioned before, I do know people who have lost patients to suicide. And um, I think one of the things, at least that's been helpful for me, is, and, other people I've kind of talked to is, sometimes us therapists also need therapists. So it can be helpful to just kind of have someone to talk to about these kinds of things. Um, and because it can certainly take a toll. There's a book that I was recommended when I was working with youth during my internship at UC Davis. I was hearing really horrific things about trauma and all these kinds of abuse and things like that. It's a book called Vicarious Trauma, and the author is a mental health provider. And she one of the first things that she talks about is she was I think on vacation, and she was like walking on these beautiful cliffs somewhere in Europe, I think. I might be misremembering that, but she was kind of like walking this very scenic place. And then instead of really enjoying it, the first thing she realized is that her thought is like, I wonder how many people have jumped from here. And I think that speaks to, the toll it can have on people who work in this space. So I think one of the things I try to do personally is to remind myself that I only really see kind of like some really severe like suffering in the world, like as a clinician, because that's kind of what I specialize in. I'm kind of seeing the tail end of a bell curve. Yes, there are people who are suffering, there is pain, but then in like DBT kind of language, joy and pain coexist at the same time. Someone's most horrible day is also someone's most beautiful day. Like, when that person made an attempt, probably some very joyous things were happening too. Someone was born, someone got married. And it's just kind of all coexists, and it's something that we have to learn to sit with, because that's just the reality of life. I feel like that for me, I hope it doesn't come off as like callous in any way. It's just kind of like what the reality is. There will be joy and there will be pain, and both will kind of come and go. And so I think that's something that's been comforting to me. And I guess the other thing would be to like trying to find meaning. I feel like that's something I've talked to coworkers about as well, who have had, similar or maybe even more painful experiences than I. And it's like one of the things that DBT talks about too is trying to find meaning in like pain and suffering. Um, so
Very Frankel of you.
Yes. So, when I was talking about how, at the very beginning when we started our conversation about how I was working with those kids at Boston Children's, that I feel like in some ways, even though I didn't have a name for it then, like that was me trying to make meaning of like, how do I do something about this? Like maybe I can devote myself to supporting kids and adolescents and young adults, who are in this much pain. And so I feel like that's in many ways been, rewarding to me, even when, things have gone south and when things have been really painful too. As we've kind of talked about privately, the idea of, everything has its pros and cons, and its costs and its benefits. And that's just kind of like I think that kind of like sits in this space pretty effectively.
Yes, thanks for sharing. I know this is a very dark topic to address, but it is something that you made your career about. And I'm obviously trying to give some insight into this because I care. But the way I care can come across a bit differently because I'm not obviously trained in clinical work, but I do understand some psychology and I study some philosophy and I worship rationality more than anything. That I see problems and I want to make them better. I honestly do, but I can't let my gut instincts guide my decision making or my approach. Nor can I just turn a blind eye and live in la la land since I grew up in a pretty privileged circumstance. And I think people can very frequently fall on either side of, oh, we need to help these people immediately. And it comes from a place of goodwill and kindness and tenderheartedness. But this is a very delicate topic, and it does take a lot of work and study and rationality to understand what is actually happening in these people's lives. So to want to face it and endure that darkness, strategies have to be implemented on a very personal level so that you don't get dragged down by it either, so that you live to fight another day. And I think that's a very difficult skill set to require, and why so few people are able to one, it's rigorous to get to where you're going just from an intellectual point of view, but then it takes a whole lot of stomach to deal with it, of all the nasty evil in the world, of working with kids that are hurting themselves. I've never worked in that environment, and I don't think I could tolerate it as well as you do.
Well, I appreciate that. I feel like it's interesting because I don't like, there's so many different ways to find meaning and support people. Like, uh, if I, because when I'm thinking back to some of my training, and there was opportunities to potentially, like, work like in cancer wards, for example, and like burn units. Like that to me would be something that I would have a really hard time kind of working in, because, I'm just kind of squeamish in general. And so I think there's just so many different ways to kind of build meaning and support other people. That it's just important to kind of recognize where those boundaries are. Like, when I first started, like, it was hard for me not to get like so emotionally wrapped up in, like, this person's life, and, thinking about, okay, how do I set that boundary? But, sometimes setting those boundaries are really important, because like boundaries with other people are like, they're just a given in any kind of relationship. And so someone might need to learn that, maybe because they had like such horrible relationships with other people before. And so boundaries weren't really a thing. And so, it's even if it seems somewhat unkind in some ways to kind of set that boundary, it might actually be for the best, in terms of, like, maybe I wouldn't be as effective as a clinician if I was working with someone who had like was in an ER and had like severe burns or something like that. Like, that might not just be my space for me.
Yes, I think that's very wise. And to reiterate the point and fuse it or integrate it with your idea of those boundaries, that you need to live to fight another day. So if you're constantly doing things that are very distressing to you or will burn you out or put you in a worse state of mind where you're not being as effective as a therapist, maybe you'll get more snippy with clients or zone out while they're talking to you. So yes, I can understand where you have to frame something like this as a marathon of, this is my career, this is my life. And since it is so emotionally intense, if I'm going to endure this for however many decades, here's the approach required. And if there's any industry standards that aren't publicly facing, or is it just very much tailored? Each individual comes up with it themselves. And then you also said therapists need therapists. So is there some sort of special training for the meta therapy of helping people process the proxy grief or the proxy trauma? Because I guess it's also a sampling error, that something might not be happening frequently, but you're exposed to it so heavily, so it biases your outlook on life because that's all you're getting exposed to, opposed to being the OBGYN helping bring babies into the
Yeah.
world.
Yeah, that's a good question. So, at least as far as I'm aware, you don't necessarily have to have like a particular kind of training to be like a therapist for a therapist. Um, in some ways, like the DBT consultation, what I mentioned like a while ago, that is in some ways kind of that, because you do have that support of other clinicians who are, supporting other people in that same way. Um, Something that's interesting is that I found that, like, when I've talked to other colleagues who do end up like receiving therapy, which, can be really helpful. I They've often kind of gone with different orientations than the ones that they're trained in. So, for example, like someone who is like trained as a CBT therapist might want to do something different because they kind of already know all the skills, they know the empirical kind of support for it. They might be able to get more out of it, out of therapy, by trying something that they just are not that familiar with. And so I think that's been interesting, in terms of like something I've kind of just observed, myself as kind of being part of the field, not necessarily like from an empirical study, but I could kind of see the rationale for that, like wanting a different perspective on the things that are happening to you, to be able to then, kind of get through the pain of maybe losing a patient, as an example.
I wonder if there would be any amount of resistance to therapy if the more you know about it. Like maybe
That's
it's
a
like some
great
sort of,
question.
maybe there's some sort of Wizard of Oz effect that once you get a look behind the curtain, you see, because I feel like I do this to my therapist sometimes, that I'm she says I'm one of her most interesting clients she's ever had, which I don't know if that's an insult or a compliment or something I should be worried about, because I'm very resistant to a lot of techniques because I'm analyzing the techniques. I'm like, I'm asking, says who, says what study, what's the mechanism here? So it's like I don't want therapy sometimes as much as I just want to understand therapy.
That's a great question. Huh. I'm trying to think of myself, as someone who did get therapy a while ago. I But then I guess the issue with kind of my example is this was before I was actually trained as a therapist. I did know, like, I mean, I had my bachelor's in psychology, but like I didn't have anywhere near the level of training I have now. And so, I feel like at that point I knew enough about therapy. It's like, okay, it works for people. Like, that kind of prompted me to kind of go there because I was hurting. Um, I'm trying to think of now what as myself. I feel like, given how I've seen it, like being able to change other people as a clinician, I feel like that would make me more like willing to kind of go back and knowing, the literature that it does work on average for most people, for a lot of people. I think then it wouldn't necessarily be kind of something I would mentally struggle with, but if there's like a, if there's like maybe like a, I don't know, like if there's something else that might be kind of nudging someone in the other direction, I could see it maybe being in that way. But it's hard to say.
Yeah, because I remember my first bout of depression was spring of 21. So at that point, it had been a year of COVID. I was still in Arlington, Virginia, right next to DC, and it was pretty intense up there. And also all other cost of living, political turmoil, et cetera, et cetera, et cetera. Finally, in a ended relationship too, finally made me crack. And on session one with my therapist, she said, "Oh, you need to do a values alignment." And she just told me to like Google it. It's like, okay, I was expecting her to email me some homework sheets or something. So I'm Googling, and I kind of engineered my own values alignment exercise. And I did it, and she goes, and I told it to her, and she across several weeks, and she goes, "Oh, that was really interesting. I've never had anybody do that before." That I invented, I won't say invented, I synthesized my own values alignment approach. And then I came across that Nietzsche quote, where it's in Schopenhauer on education. I forgot how the essay's titled, where he says, look back on your life and see what's elevated your soul and compare and contrast them and see that your true nature doesn't lie within you, it lies above you. That's when I started thinking about meaning is built. So it's not something found deep within you or out in the cosmos, it's something you build toward. So my response to therapy, more or less, was to synthesize my own existential therapeutic framework that was heavily influenced by Nietzsche, Frankl, and then the implementation intention literature. And that was, so when I think like can be a bit resistant to therapy, because once you see the inner workings, once you get the look behind the curtain, I wonder if that's why, is because I want to tailor, I'm arrogant enough to think I want to tailor whatever approach to meet my individual needs. And this segues, the reason why I'm bringing this up is because it segues into a shared experience that you and I both have, which me and several other of my friends, I'm finding us, we exist, is I had this huge collapse in meaning at 24 when I officially apostatized from evangelical Protestant Christianity. And when COVID had been around for a year and a broken relationship, the substrate that I had organized my life on had crumbled, which was the Christian Protestant Americana tradition. You are also an apostate of a similar tradition. You're a little bit different as a first-gen immigrant, but you are a PK. I was only a pastor's nephew. I was never an actual PK. So can you tell me a little bit about your struggles reconciling your apostasy with finding meaning in life with your cultural traditions as a first-gen immigrant, and how that relates to therapy and depression, and when you're therapizing clients, how their religions might interact with your therapeutic approaches?
Yeah, no, I really appreciate that. Those are some really great questions. So, um, I guess for me, yes, I guess a little bit of background. So, I was a pastor's kid, PK.
Yeah,
And
that's
so
some real Christianese right there. I don't think a lot of people know that. That
no, no, not always. And
that's
it
not
was
even
interesting 'cause I had,
Christianese. That's like
yes.
evangelical ease. Only certain denominations use that. So
Yes. So yes, my dad was Lutheran, and so I grew up kind of like in the Lutheran church. I mean, I would go to Sunday school every Sunday. I would help out like with the service, like I'd see my dad lecture or like sermonize, or, and so that was definitely like something I very strongly believed in, um, for I would say most of my teenage years, like maybe up to like 18, 19. I went to college, and I feel like that was the first time I had ever really lived with people who had like very different perspectives on spirituality and religion. One of my friends also came from a Christian background, one of my roommates, and then I had a roommate who, I'm still really close with both of them actually, but the other roommate was someone who considers himself an atheist. And I remember, during the freshman year, you would have like all these like philosophical conversations about God, um, and just kind of hearing them, and, me just kind of talk about our experiences and thinking about like, why does it make sense to believe in God versus not? Um, and we the evidence for and against, and all the people who have ever philosophized out about this, lots of pastors, and there's like famous atheists, for example, like Richard Dawkins. And I was actually lucky enough to meet Richard Dawkins when I was in college, which was a very interesting experience. But that it was something that continued to interest me like on an intellectual level, and I realized like as I kind of went through college, this narrative of, believing in this all loving God, and Jesus and all that, as, Lutherans do. Um, it didn't quite fit with, what I was kind of learning in psychology, or, even just kind of the way I identified in terms of like my sexual orientation. That was something that I decided to not kind of, I guess, embrace because of all of these things, all the dictates of religion, and how, from a more conservative Christian background, being gay is not necessarily something that's allowable or okay. And so, with that said, I started kind of to drift away from the church and, kind of think about life in a more scientific way, or, more philosophical way that was kind of divorced from religion. And over the years, I feel like it's been something that you know, I, I've learned to kind of appreciate more. I identify now as kind of agnostic in that, like, I can't necessarily prove that there is or not a God. It's kind of my personal belief. Um, and then even thinking back to my own experiences, I recognize, how religion during that time did bring me a lot of like meaning and support. Like it brought me, especially when my dad got sick and he passed away when I was in college, like religion and Christianity was something that I found a lot of comfort in, especially all the people that I knew from my church. Like they sent me lots of cards, wishing me well and my family well. They really helped my mom out. And so I could I've really learned, how helpful religion and, can be for people, especially if, thinking about this from a psychological perspective again, or like scientific perspective about, the conversations we had about like building like community. Religion can be very effective at that. Um, and so it's something I obviously don't want to be like dismissive of when I'm meeting with clients who maybe are struggling with similar experiences or trying to think about how, their values might or might not align with the particular religion that they currently kind of feel like is right for them. One of the things, I guess, going back to the idea of like finding meaning in life versus the meaning or like the meaning of life is I feel like my job is not to help people find the meaning of life. It's to find some meaning in life in whatever way that works for them. And so, when we're thinking about religion, I really want to make sure people explore, the options that they might have. I remember meeting with one client who was also struggling with sexual orientation, coming from a very conservative Christian background. And, how I told them that there are other Christian, I guess, denominations who are maybe more accepting, that there's maybe other avenues to still believe in God and, think about heaven and all those kinds of things and believe in that while at the same time being true to who you are as a person in terms of like your sexual identity. So I think that's kind of the approach I try to take with folks. So it's not something that, I'm dictating what their values should be, because we all have enough of that as people who live in society. Um, so that's kind of like the space I try to kind of build for folks.
Nice. Thanks for such a great answer. And when I primed this question, I said, this is a shared experience and I know of others, right? I'm trying to collect us and have these conversations. And there's another friend of mine. He's interesting because he was Mormon, but he was also, or is gay, and left over his sexuality. And then also he got to look behind the curtain and he thinks Mormonism is complete nonsense anyway. But it is an interesting existential experience that I think can help really when you find other people who sincerely believed the faith or the religion as much as you or me or some of my friends have, and then sincerely reject it, where in my biased opinion, I see a lot of people that they kind of go to church because that's the cultural prescriptive thing to do. And then they just kind of stop going when they don't feel like it, but they'll still call themselves Christian or whatever other religion they might be a part of. So they're more of the creaster or nominal religious types. Whereas some of us, we're much more hot or cold about it, where we drew a line and said, as of today, no more, or this is not me anymore. And I'm bringing this up because of that meaning of life, meaning in life paradigm and how it's caused me a lot of anxiety and depression. Because when I was in the faith, I was told, by and large, this is the meaning of life in the Southern Baptist, Protestant, evangelical flair of Christianity, which is very different than other flares of Christianity too. And then once I removed that substrate, I didn't have a leg to stand on to justify my actions anymore of what is good and evil or what is a meaningful life, which has sent me on this quest of the meaning in life pursuit, which is very much in line with your therapeutic practices, very much in line with the ACT and with, I forget, Marsha Linehan's work.
DBT. Yeah.
DBT, sorry. Of yes, we've all experienced this crisis of meaning in our lives because we had the courage, so to speak, to say no to this culturally prescriptive notion of how to live our lives. And from my point of view, it's a very enlightening but grueling experience that I want people to go through because you come out stronger on the other side. But I don't want people to go through the emotional toll it had on me to really have that substrate collapse. And I can see why people go to church or participate in religion. It provides easy answers. It provides easy ways to live life, and it provides the community. I am only where I am today because I had a strong community that was by and large architected from church groups that I could rely on and stand on. And then architecting new support structures apart from that has been a very difficult and interesting experience. So in the age of the meaning crisis, people are isolating themselves. Religion has been on the decline. I read some literature that young men apparently are increasing in numbers to become
Yeah.
priests. Totally weird. And all of this seems to be tied to suicide, meaning in life, the meaning crisis, and then you doing the dirty work of doing the research and trying to help people through this tough time. You definitely have the more rigorous, scientific, professionally trained background in it and directly dealing with it, where I'm coming at it from a more synthetic, philosophical approach of trying to be a little bit more zoomed out and understanding not that it is happening, but why is it happening? And I think the apostasy crisis, or I don't know if it's a crisis, but the apostasy of the West seems to be playing a huge role in it.
Yeah. Well, I mean, I feel like I appreciate kind of like your thoughts on that, and I'm also, I appreciate people, just kind of supporting other people in general in whatever way that might look like. Because, like I mentioned before, there's not necessarily one size fits all solution to suicide or mental health issues in general. Like, it's going to take very many different approaches. Like for some people, therapy is either inaccessible because, it is expensive. Most people, like lots of therapists don't accept insurance, for example. Um, and, sometimes people just don't have the time to sit down for like an hour every week to be able to talk to someone, or like there aren't any therapists around that they can really talk to because they live in a place that has like deficits in like healthcare. So there's just many reasons why I think, therapy, as much as it can be helpful to people, it's not going to be the only solution to either suicide or depression or like whatever other mental health condition we're talking about, or there's going to take a multi-pronged approach. And so I think there's a lot many of us, like all of us, I think, can do to kind of support our fellow human being.
Yes, that's a very kind-hearted, optimistic take on it. So thank you. And
Yeah, got to remain optimistic.
yes. And final question, this is something I joked about with you when I was texting, is how has becoming a clinical psychologist affected your personal relationships, wherein you notice you are behaving more in a professional way with personal friendships whenever, or personal relationships, not necessarily friendships, when somebody's struggling, you subconsciously or automatically put on your psychologist cap. And how do you balance being a friend or a partner or a brother, son, like all the innate characteristics, versus being a trained professional?
That's a great question. I mean, I feel like it's going to be something I continue to like wrestle with for the rest of my life. But, um, when I think about myself before I went through grad school, as an example, like I feel like I would often more quickly jump to like problem solving with someone because I've obviously wanted them to feel better. But as time has gone by, like I've recognized through training, right, that people don't often respond that well to that. They probably want validation first. And so and validating like is something that any friend can really do, but I feel like that's kind of shifted my perspective a little bit of like, I'm really sorry to hear that that's really tough. Like, how does that make you like kind of act or feel in that situation? So I slowed down a little bit when I try to support people, um, like within my life. I do try to tread lightly because, when it comes to a friendship, right, you want to balance each other's kind of needs in that relationship. Like I have needs, the other person has needs, and, a relationship is kind of give and take in that way. That's like a friendship. But then when we're thinking about like a therapeutic relationship, usually the client's needs come first. Like yours are not something yours are kind of like what comes second. And so that's not, and then obviously there's like this power differential between you and the client because the client often, most of the time, doesn't really know that much about you as a therapist. And so you want to be mindful of that, or at least I try to be, because, that's not the kind of dynamic I want to have with people. And in like in a friendship, what I want is, we both have wants and needs, and we're kind of helping each other kind of meet those in some way and learn from one another as friends. But it is kind of a balancing acting with like family or like my partner or things like that. Cause I'm never 100% sure if like, am I being too therapist-y here or not? I mean, people are welcome to call me out on it, but it is part of who I am, and it's hard to make that divide sometimes because it's, you know, it's not like I can just like turn off like what's that show, Severance? I'm not a completely different person like outside of the therapy room than I am like inside the therapy room. But it is an interesting kind of gray space to kind of live in, I suppose. It keeps me on my toes.
Nice, nice. Well, Robert, thank you.
Absolutely.